the opportunity to earn 3% pay increase per year for the next 3 years, allowing nurses to choose whether or not they wanted to be in the union, staffing to national benchmarks, and a total of nearly 80 other tentative agreements. Despite what you are hearing them say, personal protective equipment, or PPE, such as masks and gowns, were not part of any open issue in the contract. Unfortunately, but not surprisingly, the union once again rejected our offer. The act of striking is, in at least some part, meant to create a dynamic whereby there is a service interruption at a particular job site. But we are no ordinary job site. We are an academic medical center, a place of education, research, and healing. We are a place of healing. And therefore, to purposefully and willfully create service interruptions here on this campus, by definition, would put the lives of patients in jeopardy. Therefore, the words strike and hospital used in the same sentence should give you great pause. But there is another word much more powerful than strike, and that word is mission. It's a word we all take very seriously here at Albany Med. Our mission. We are committed to improving health by attaining the highest standard of quality in care delivery, education, and research initiatives. And while today is sad for the reasons I have described, it is also a day that fills me with enormous pride, because I can state with great satisfaction today there are no interruptions. Our mission continues unabated, as it has for 181 years. As for the strike, my belief is that it was nothing more than a reckless gamble, and they have struck out. Today, as it did yesterday, and as it will tomorrow, babies are being born at Albany Med safely. Today, as it did yesterday, and as it will tomorrow, complex surgeries of the heart and the brain and on small children are being performed at Albany Med safely. Surgeries, I might add, that in many cases are done at no other hospital within 25 counties. Today, as it did yesterday, and as it will tomorrow, people with cancer are being treated at Albany Med safely. Today, as it did yesterday, and as it will tomorrow, heart attacks, strokes, trauma patients are being treated at Albany Med safely. Today, as it did yesterday, and as it will tomorrow, patients are being transferred by helicopter and by ambulance to receive care that only can be delivered in this region here at Albany Med safely. And yes, today, as it did yesterday, and as it will tomorrow, patients with COVID-19 are being treated here at Albany Med safely. How did we do this? How have we been able to continue our sacred mission? The answer is quite simple: our remarkable workforce. I am moved beyond words to see how our workforce, our Albany Med family, has rallied together, supporting each other and remaining at the aid of our patients. At the last press conference, I mentioned that we had many nurses who were disenfranchised from voting, that they were marginalized and made to feel unwelcome by the union that is allegedly representing them. It remains our position that that vote was stacked, thus allowing NYSNA to deliver the strike authorization that they wanted. A strike authorization that, I will add, has been widely criticized and is reckless and ill-timed. It is worth noting that to date, the number of voters and the results of that vote have not been released by NYSNA. But that's okay, because we have numbers. And unlike NYSNA, I will share them with you in just one moment. I told you that the nurses would have another chance to vote, this time with their feet and with their hearts. And oh, did they ever. Because in addition to the very professional and talented nurses, part of a replacement workforce that we brought in to help ensure that we could continue our mission on this campus, we allowed for, and in fact, we encouraged Albany Med nurses to work today. There was no lockout. I am pleased to report that for the day shift today here at Albany Med, 408 Albany Med nurses are working today here in this hospital. All of our inpatient settings, outpatient settings, and faculty practice locations. And we know that many more have already told us that they will be coming into work tonight to care for our patients on the evening and the overnight shift. So that number, 408, will certainly grow. To put that in perspective, we had 538 nurses scheduled to work today. So right now, 76% of all the shifts are being filled with Albany Med nurses. I repeat, over 3/4 of all the shifts currently here are being filled by Albany Med nurses. In comparison, we had 260 unexcused absences today. So there are 148 more nurses who showed up to work than chose to strike. Our nurses have indeed voted with their feet and with their hearts, and they have voted overwhelmingly in support of our patients. They have voted overwhelmingly in support of our mission, and they have voted to stand with Albany Med. To those 408 nurses who came into work today, you made a brave and patient-centric decision. You did not abandon your patients. I thank you all, each and every one of you. We have been well prepared for this day, thanks to the skillful work of colleagues across all areas of the medical center, bringing their unique talents and perspectives together to cover every single angle. Because of them, we made this a safe place for our nurses to come to work and for our patients to seek the care that only we can provide. This morning, before the sun came up, more than 100 Albany Med staff members, dressed proudly in Albany Med blue, volunteered to assist with logistics, guiding staff and patients safely across the main campus, ensuring uninterrupted quality patient care, research, and education. And tonight, when the day shift goes home and the evening and the night shift arrives, this same incredible workforce will once again rise up and deliver for our community. This proves that we are stronger together. I sincerely thank my colleagues who went above and beyond to continue our mission. They believed fiercely in our role as a place of healing. They know that our community is counting on us to continue to care for them. During a pandemic, they rose to the challenge. They are the leaders of this organization, and we have their backs. And while we remained focused on our preparedness plans, NYSNA continued to make several unsubstantiated claims that are false and irresponsible. Allow me to address the most significant ones. Albany Med did not encourage nurses to resign from the union. Because our nurses deserve the facts and the truth, we published information about the choice of union membership. That is absolutely legal. We believe our nurses should have access to such information as much as possible before making any decision. And as you can see, evidenced by what is happening today here on this campus, a growing majority of our nurses reject NYSNA. Our supply of personal protective equipment remains adequate. Any reprocessing of N95 masks is done in line with federal and state guidance. I know this firsthand, personally, for when I work in the emergency department, as I did on Thanksgiving, and when my wife works in the pediatric emergency department, as she is doing right now. We wear the same PPE as all the staff wears. And yes, we treat COVID patients. And yes, We are safe because we have the absolute best epidemiology team, the best infection preventionists, and the best sterile processing unit. Our practices at Albany Med are and remain safe. If there is any need to make any changes in the future, as always, we will take guidance from them and from the science. The health and safety of our patients and our workforce is always our top priority. And Dr. Venditti will address this issue in a moment. But I am going to continue to focus on the positives. How many nurses bravely chose to work today? How many patients trusted us to continue receiving care at Albany Med? How our community is looking for us to fight the coronavirus pandemic. Our mission is stronger than ever, and we are stronger together. At this time, I'd like to introduce Executive Vice President, Chief Operating Officer, and Chief Financial Officer, Francis Spear-Alpert, who will discuss various operations and financial details.
Thank you, Dr. McKenna, and good afternoon, everyone. I would also like to express my genuine and heartfelt thanks to our nurses and all of our employees who are continuing to care for our patients and equally important for each other today. We have said that we will not abandon our patients, and we have kept our word. In our hospital and practice locations right now, members of our community are getting the care they expect and the care that they deserve. That would not be possible without a team of hardworking, dedicated employees who truly take this mission to heart. Safety, indeed, is our top priority at all times. We have taken extraordinary measures to protect our community and to protect our workforce throughout the coronavirus pandemic. Any suggestion otherwise is absolutely untrue. We are also committed to keeping our entire workforce safe during this strike. We have enacted heightened security measures so employees may come and go from the KIPP facilities without any disruption. Picketing activities remain on public property so patients can come and go as well safely as needed. It is no secret that this has been an extremely challenging year for all of us, and hospitals have been hit especially hard. Albany Med is the region's largest and only locally governed health system. During the first wave of the pandemic, our patient volumes dropped precipitously, and to date, we have incurred an operating loss from our core missions of about $10 million. Still, we know and we demonstrate that our workforce is our most important resource, and that is why, despite these fiscal challenges, Albany Med is one of very few hospitals in the entire country who has not laid off or furloughed any of their team members. The topic of wages has been disputed by the union. However, our nurses are paid very competitively. As Dr. McKenna mentioned, the contract proposal that was rejected by NYSNA would have guaranteed up to 3% raises per year for the next 3 years. When we all look back on this time in our history, I believe our community will view Albany Med as a lighthouse in what has been an absolutely frightening storm. While we are very saddened by today's events, we are also tremendously grateful to the members of our workforce who came to work and made that important choice to care for our patients and, again, to care for one another. And equally important, I do look forward to all of us building a united future together. One team, one mission. We have been with our community throughout the coronavirus pandemic, and we will always be here for our community. I'd like to introduce now Dr. Fred Venditti. He is our System General Director and will update you regarding patient care, patient safety, and staffing.
Thank you, Fran. Good afternoon. First, let me start by assuring you, all of you and the public, that despite this strike in the middle of a pandemic, Albany Medical Center is open. Albany Medical Center is open and providing care, needed care, to members of our community. We've discussed previously that we've got a very elaborate strike plan. That strike plan has been activated and will remain in place throughout the time of this strike. In addition, we've also activated our incident command structure. Incident command allows us to carry out our strike plan efficiently, again, despite the COVID pandemic and other things happening in this community. The team on that incident command includes all members of departments here in the organization across the whole medical center. In addition to the many dedicated nurses that Dr. McKenna spoke of who crossed the picket line to come to work today, we have temporary nurses here at the medical center as well. Those nurses have all been tested and they are negative for COVID-19. They are following all of our safety protocols for COVID-19. They're wearing masks, they're wearing face goggles or shields, they're temperature monitoring and symptom monitoring, just as we would expect all of our permanent nurses to do. Safety is really a priority for us, as stated already, both the safety of our staff and the safety of our patients. We follow all the appropriate safety protocols and policies with respect to not only staffing, but to PPE. We have the required 90-day supply of PPE here at the medical center, including masks, face shields, gowns, gloves, etc. Literally thousands of all those items. Part of the reason we have adequate supplies is we have been very careful in how we use them. We reprocess masks following the CDC guidelines, using techniques that the state has confirmed are appropriate. And oh, by the way, techniques that are used by almost every hospital in this state and many, many hospitals across the country, including some of the most notable infectious disease centers. Any accusations that we are not following the appropriate policies, procedures, or approach to the safety of our staff or patients are frankly absurd and frankly insulting. As I said today in the beginning of my talk here, we're providing the needed care to our community today. We're caring today for 63 COVID-positive patients in the hospital, and we're doing that well. Our outpatient appointments and elective surgeries are continuing today. This morning, up until noon, we have cared for 2,174 patients in our physician offices, in our hospital outpatient areas, and in our emergency departments. And we're doing that well. This morning, I actually walked through the waiting area of our main OR. There were about 25 people waiting there to go in. And I stopped and I introduced myself. I told them I was the hospital general director and that we're here for them today and we're going to provide their care and we're going to do that safely. They spontaneously started to applaud. That's what our community thinks about us. And as Dr. McKenna said, we've also delivered babies today, several, including an 8-pound, 2-ounce baby boy, healthy baby boy this morning to new parents, the first of the day. Congratulations to them. We thank our community for continuing to turn to us for their care. As we have said throughout this pandemic, please don't delay care that you need. We take our role for healing very seriously, and we don't want anyone to delay that care that they need, not to put off an appointment or a procedure for any issue, not even for a day. With that, let me introduce Dr. Louis Philhauer, our interim chief nursing officer, to talk more about our nurses.
Good afternoon. Nearly 700 temporary nurses have been contracted to work with Albany Med during a 3-day period starting today. Nurses who are NYSNA members have a protected right not to work their scheduled shift today, and we respect that right. Because Albany Med had to hire temporary nurses, and because we must contract with them for a minimum of 3 days, Albany Med also has a protected right to use the temporary nurses all 3 days to replace a striking nurse, even if they were only on strike for 1 day. This is called delayed reinstatement and is not a lockout. If a nurse chooses not to work a scheduled shift today, managers will inform them that they have been replaced by a temporary nurse and they will not be permitted to work until the next scheduled shift starting at or after 7 a.m. Friday, December 4th. Any attempt to return to work before 7 a.m. December 4th is not a protected action under this strike notice. Attempting to come on campus during the delayed reinstatement period, other than for medical care, is a violation of hospital policy and will result in disciplinary action. I join Dr. McKenna, Fran, and Dr. Meditti in thanking the tremendous and many nurses who chose to work today and look forward to working with our nurses for many more days to come. I will now reintroduce Dr. McKenna.
Thank you, Dr. Philhauer. Once again, Albany Med is a place of healing. That is what we have been for 181 years. That is what we are today, and that is what we will be when the strike is behind us. We will welcome all of our nurses back on campus this week, those who chose to strike and those who did not. I have said before, we are stronger together. That is true today. In fact, it will always be true. Now I will ask if any of the reporters that are in this room have any questions. After we've gone through those questions, we will open up to the WebEx for questions as well, and I may call upon others to come up and assist with the answering of some of those questions.
This doesn't have to do with the strike, but it is probably more important in the immediate future, and that is yesterday the governor gave you a list, hospitals across the state, a list of requirements to adjust in case there is a capacity issue. Do you have anything to say about that list, which he had 3 major points, but there were a lot of sub-points underneath those concerning systems in themselves and such?
Very good. Dr. Venditti is the hospital system general director. He's responsible for all of those activities. I'll be happy to let him answer that.
So yes, the governor has issued some requirements, some actions that he wants us to take. Load balancing as an example across networks. We've had a little bit of communication across our network this morning, but frankly there are several other things going on in the medical center at the moment. So we will address those issues in due time.
Is his fear well-founded as it relates to this area, though, as far as capacity?
So as we've said before, we have a regional call every week. So our next regional call is tomorrow morning at 7:30. 12 hospitals in our region. We share data. We share clinical practices, best practices. We help each other. Frankly, we are beginning to see more and more hospitalized patients with COVID, but I think we are well poised to act as a region to serve the community well. So I think we'll be prepared.
What about the additional 50% capacity, I think he said, which is very similar to earlier this year in the spring? Is that something that you're ready to do at this point? I know
So we had created that plan back in the spring. We reviewed it in the summer, modified it, and have reviewed it again recently. So we have a 5-tier plan to expand our capacity here at the medical center to meet that requirement.
There's been reports of possible COVID outbreaks in the oncology unit and different units throughout the hospital. Any response about that?
So COVID has grown in the community at large. So there are day after day of record-setting number of positive cases in our community. I think we're the last 4 days now in Albany County have set record numbers. Some of our staff have contracted COVID out in the community, and obviously we do have patients in the hospital with COVID. We do take all appropriate precautions to prevent spread in the hospital.
With respect to the cost of the replacement nurses, we will not have the final bill for that till all is said and done and we do a full reconciliation. But as mentioned earlier, despite that cost, all of our core missions, all of our patient care, patient services remain uninterrupted.
Hi, can you please explain what you meant by PPE not being part of any open issue in the contract?
For those who did not hear, the question was, can we explain by the comment that there's nothing related to PPE in the open contract? That's a factually true statement. When both sides come to the negotiation table, they share different things they want to have in the contract. Over the last 2.5 years, we've had over 80 tentative agreements. There are a handful, a small number of open issues still in which we are having discussions. None of those open issues relate to personal protective equipment. I'll take the second question first. We have an incredibly professional team of infection preventionists who work 24 hours a day trying to keep track of anybody who might be positive. As Dr. Venditti mentioned, we're seeing an increase in the prevalence in the community. Our members who work here are members in the community as well. So not surprisingly, we're seeing an increase in the number of employed staff who may test positive. Our process is whenever we have an employee who tests positive, we go ahead and we do an investigation into that individual, where they work, which colleagues they've been near, which patients they've cared for. And I can say with absolute confidence that our process is one that I think identifies all of the close encounters and anybody that might be exposed to that person. As far as the first number, I don't have that number available at this time as far as the number of employees. That does not sound accurate.
WNYT question. We're looking at the number of cases going up. Is there any plan to set up any sort of field hospital beds, or would we potentially need to do that?
So the question is there any plans to set up a field hospital for COVID? Dr. Venditti.
So as I said, we have a 5-tier plan to create capacity. Within that plan, as you might imagine, this is a very big campus. There are some very large rooms, if you will, within the campus, and we have plans to use those in a very safe, appropriate way, if necessary, if we get to very, very large numbers of COVID patients. We do not have a plan to create a facility outside of our campus. So first of all, The way we reprocess masks, and we don't reprocess these masks, so these surgical masks that many of you have on are not the masks we're talking about. They're N95 masks, so they're different masks, they're more substantive, they're firm. The way we reprocess them is with either ultraviolet light or aerosolized hydrogen peroxide. And what we do is we reprocess an individual's mask. So it's your mask. You've worn it. We then put it in a brown bag, disinfect it, give it back to you in a white bag. It's not my mask or Dr. McKenna's mask. It's your mask. And some people wear makeup, so there could be makeup on that mask. We try to identify that and discard those masks. We do not give them soiled masks that are soiled on the outside, but there are some masks that might have a little bit of residue of makeup from an individual. It's their own makeup. And that's what's on that picture that you're seeing.
Talk a little bit about the seriousness of, this issue affecting the nurses that we see COVID cases continue to rise across the region, and kind of how you manage those two issues during
Can you repeat that? I'm sorry.
As the number of COVID cases continue to rise and the nursing issue, talk a little bit about the seriousness of the two issues running parallel. And is the hiring of temporary nurses sustainable moving forward as we combat the pandemic?
So remember, the strike is for a single day, 24 hours. So we have plenty of temporary nurses to cover that. We will go back to our permanent employed nurses as the nursing staff at the medical center after this is over. So there won't be a need to continue with the temporary nurses, if I'm understanding your question correctly. So the question is, if there's another strike, we will have a plan to deal with that. We'll take into account the circumstances at the time, and we will deal with that event in a safe and appropriate way.
As it relates to load balancing specifically, the governor said yesterday something that I didn't really understand. He said if the hospital system is overwhelmed and it turns out that they investigate and they did not load balance, that is malpractice. Is that his opinion? Is that like a legal classification under the executive order? What exactly does malpractice mean in that context?
I think you need to ask Governor Cuomo.
What is the hospital's current strategy for testing patients? Does it test every patient who comes in or only asymptomatic patients? And additionally, if the latter, as cases are rising in our community, do you think it makes sense to start testing all?
So at this time, we're only testing symptomatic patients or patients who are coming in for procedures or who are going to go anesthesia. Those patients who we have a suspicion of, who initially test negative, we have now started a policy of retesting them a couple days later, because we have seen initial negatives that then later become positive. All those patients are on precautions, so staff are advised to wear all the appropriate PPE when they interact with them. We have an ongoing discussion with the epidemiology group that Dr. McKenna's referred to about whether at some point we should start testing all patients coming into the hospital. We don't think the prevalence of the disease yet warrants that.
Just two comments I'll make. In follow-up to the question about the employees who have tested positive, what I can tell you is that despite the fact that our employees are treating patients with COVID, often on ventilators or taking care of them at the bedside, 2/3 of our employees who have tested positive have contracted COVID in the community. I think that speaks significantly to the safe practices here, so that despite the fact that we're caring for COVID patients, our employees are more likely to pick it up in the community than they are here at the bedside. Following up on what Dr. Venditti said, I think it's important to point out that from the beginning, we have been an organization which has studied the science. And as standards and practices evolve, we too will evolve. And we will take our guidance from the people that we consider to be the experts on personal protective equipment, sterilization, testing, and those experts are epidemiology and infection prevention. They are not NISNA. Any other questions?
Is there any chance that you have the numbers on hand for how many COVID patients you have in the hospital right now and how close you are to capacity?
You want to take that? We do, Daryl.
So the 11 o'clock report, we have 63, take my mask off, 63 patients in the hospital that are COVID positive. 13 of them are in intensive care. 3 of them are on ventilators. We have plenty of capacity. We're not anywhere near our capacity, either for caring for COVID patients or in general.
Before we close it out, are there any final questions? And I'm looking up at Matt. Okay. We thank you for coming out today to cover this very important story. Once again, I'll conclude by saying how incredibly proud I am of our workforce here, especially those individuals who made the decision to come in today and care for our patients. We stand with them, and we always will. Thank you very much.